am going to talk about the disease measles. Measles is a contagious viral infection that can be serious for small children, but it is easily preventable by a vaccine. This infection caused by the rubella virus causes a fever, rash, cough, runny nose and red eyes. Ear infection, diarrhea, pneumonia and in rare cases brain damage and even death can occur. This disease still kills more than 2 lakh people per year. Symptoms: measles signs and symptoms appear around 10 to 14 days after exposure to the virus. Signs and symptoms include fever, dry cough, runny nose, sore throat, inflamed eyes, tiny white spots with bluish white centers on a red background found inside the mouth on the inner linings of the cheeks, also called as Koplik spots. A skin rash made up of large flat blotches that often flow onto one another. The infection occurs in stages over 2 to 3 weeks. Infection and incubation. For the first 10 to 14 days after infection, the measles virus spreads in the body. There is no signs or symptoms of measles during this time. Non-specific signs and symptoms. Measles. Measles typically begins with mild to moderate fever, often with a persistent cough, a runny nose, inflamed eyes that is conjunctivitis and a sore throat. This relatively mild illness may last 2 to 3 days. Acute illness and rash. The rash is made up of small red spots, some of which are slightly raised spots and bumps in tight clusters, gives the skin a splotchy red appearance. The face breaks out first. Over the next few days, the rash appears down the arms, chest and the back, and then over thighs, lower legs and the feet. At the same time, the fever rises sharply, often as high as 104 to 105.8 degree Fahrenheit. Recovery. The measles rash may last about 7 days. The rash gradually fades first from the face and last from the thighs and feet. As other symptoms of the illness go away, the cough and the darkening or peeling of the skin where the rash stay about 10 days. When can a person spread the measles virus? A person with measles can spread the virus to others for about 8 days, starting 4 days before the rash appears and ending when the rash has been present for 4 days. When to see a doctor? Call your healthcare provider if your child has a rash that looks like measles. Causes. Measles is a highly contagious illness which is easily spread to others. Measles is caused by a virus found on the nose and throat of an infected child or adult. When someone with measles coughs or sneezes or talks, infectious droplets may spray into the air, where other people can breathe them in. The infectious droplets can hang in the air for about an hour. The infectious droplets may also land on a surface and live and spread for several hours. You can get the measles virus by putting your fingers in your mouth or nose or rubbing your eyes after touching the infected surfaces. Measles is highly contagious from about 4 days after the rash appears. About 90% of people who haven't had measles or been vaccinated against measles will become infected when exposed to someone with measles virus. Risk factors. Risk factors for measles include being unvaccinated. If you haven't had the measles virus, you are much likely to have the measles. Traveling internationally. If you travel to countries where measles is more common, you are at the higher risk of catching measles. Having vitamin A deficiency. If you don't have vitamin A in your diet, you may develop symptoms and complications of measles. Complications. Complications of measles may include diarrhea and vomiting. Diarrhea and vomiting can result in losing too much water from the body. Ear infection. One of the most common complications of measles is a bacterial ear infection, bronchitis, laryngitis or croup. Measles may lead to irritation and swelling of the airways. It can also lead to inflammation of the inner walls lining the main air passage ways of the lungs. Measles can also cause inflammation of the voice box. Pneumonia. Measles can commonly cause an infection in the lungs. People with weakened immune system can develop an especially dangerous type of pneumonia that sometimes can lead even to death. Encephalitis. About 1 in 1000 people with measles can develop a complication called encephalitis. Encephalitis is an irritation and swelling of the brain. The condition can be especially dangerous for people with weakened immune systems. Encephalitis may occur right after measles, or it might occur until months later. Encephalitis can cause permanent brain damage. Pregnancy problems. If you are pregnant, you need to take special care to avoid measles because the disease can cause premature birth, low birth weight, and fetal death. Preventive ways. The most effective way to prevent measles by vaccination with measles, mumps, and rubella, that is MMR vaccine. MMR vaccine is a combination vaccine that protects against measles, mumps, and rubella. It is recommended to receive 2 doses of MMR vaccine, ideally between 12 and 15 months of age and between 4 and 6 years of age. Prevention. Wash hands frequently with soap and water, especially after contact with potentially contaminated surfaces. Avoiding contact. Avoid close contact with individuals who are ill with measles and stay home if you are feeling unwell. Covering coughs and sneezes. Cough and sneeze into your upper sleeve or elbow and use a tissue when coughing or sneezing. Disinfecting surfaces. Disinfect frequently touched surfaces, especially in shared spaces like offices or schools to help to prevent the spread of the virus. Staying in the home when sick. If you suspect you have measles or feeling unwell, stay home to prevent further transmission. Mask. Consider wearing a mask in public if you are unwell or at higher risk of exposure. If you want more information, please like, share and subscribe to my channel. Thank you.